Hey everyone, let's talk about something we've probably all felt at some point. That nagging, weird pain, or maybe some numbness or tingling that runs down your arm. But what if the real culprit isn't in your arm at all? What if it's hiding somewhere you'd never expect?
Right? It's a question that pops into your head almost immediately. Is this arm pain actually coming from my neck? Well, that's a surprisingly common scenario. And it turns out clinicians have a very specific tool they use to investigate exactly that.
And that tool, the real star of our explainer today, is called Spurling's sign. You can think of it as a crucial diagnostic clue that helps solve this very common mystery.
Okay, so what exactly is it? At its core, Spurling's sign is a physical exam maneuver. Its entire purpose is to help a clinician figure out if a nerve root in your neck, that's your cervical spine, is being compressed or irritated, which in turn sends those confusing signals down your arm.
Now, that might sound a little technical, but the procedure itself is surprisingly straightforward. So, how exactly do they do it? Let's walk through it.
What's pretty amazing here is just how simple the movements are. So you're sitting down, and a clinician will first gently guide your head, rotating and tilting it toward the side where you have the symptoms. Next, they apply just a little bit of downward pressure on top of your head. And the whole time, they're watching for one thing and one thing only. Does this specific set of movements bring back those familiar symptoms?
Because that reaction, or lack of one, is everything. So after the maneuver is done, how do clinicians decode the results? And, what does it actually mean for the person being tested? Well, the interpretation is actually very direct. A positive test is exactly what it sounds like. It's when the maneuver successfully reproduces the exact symptoms the patient has been feeling, that specific pain or that numbness or that tingling that shoots down the arm. It's almost like they found a switch that temporarily turns the symptom back on. And that, of course, leads to the obvious next question: why? Why does this simple movement of the head suddenly cause that pain to come back? Well, the answer lies in the incredible anatomy of your neck. Here's the mechanism, and it's actually pretty cool. Your spinal nerves have to exit the spine through these little openings called the intervertebral foramen. Just think of them as tiny doorways for each nerve. The Spurling's maneuver, that rotation and tilting of the head, it temporarily makes that little doorway just a little bit smaller. So if a nerve is already irritated or inflamed, this gentle closing of the door is just enough to pinch it and bring back those symptoms. That's what clinicians call radicular symptoms, pain that radiates out from a nerve root. So the main takeaway here is pretty clear. When that maneuver triggers the symptoms, it's a very, very strong clue. A positive test is considered a powerful indicator that strongly suggests there's some kind of nerve root compression going on. Now let's talk numbers, because this is where you see the test's real strengths and also its weaknesses. First off, it has an 88% specificity. So what does that mean? It means this test is excellent at confirming the condition. If you get a positive result, there's an 88% chance you genuinely have nerve root compression. It's very good at avoiding false alarms. But, and this is a really big but, here's the other side of the coin. It only has about a 50% sensitivity. This means the test only catches the problem about half the time. So if your test is negative, it doesn't mean you're in the clear. You could be one of the 50% of people with the condition that the test just happened to miss. It's a key distinction. To put it another way, specificity, where this test is strong, is about correctly identifying people who don't have the condition, which means a positive result is very likely true. Sensitivity is about correctly identifying everyone who does have the condition. Spurling's is great at the first one, but just okay at the second. That's why it's only one piece of the puzzle. And just like any diagnostic tool, there's always some important fine print. So let's cover a few crucial things to know, and a little bit of the history behind the test itself. Okay, and this part is absolutely critical. This test should never be performed if there's been recent acute trauma, like from a car accident, or if there's any reason at all to suspect that the neck is unstable. Applying pressure in those scenarios could cause serious harm. This is a tool for investigating stable, ongoing conditions, not an emergency room maneuver. And just for a bit of context, this isn't some newfangled test. It's been a trusted part of the clinical toolkit for decades. It was first described all the way back in 1944 by the American neurosurgeon Roy Glynn Spurling, who it's named after. So we've seen that a positive Spurling sign is a powerful clue, but a negative result doesn't close the case, which leaves us with a final thought, right?
This one test is just a single piece of a complex diagnostic puzzle. It really highlights that understanding our body's signals is rarely about a single answer, but about piecing together the whole story. What other hidden connections might be causing the aches and pains we feel every day?